So good afternoon, everyone. I'm Mayor Paulette Guajardo, and I thank you for joining us today. Due to a rise in COVID-19 cases, we felt as a city and county that it was important to brief you today on the latest COVID-19 news. So due to the Delta variant spreading, hospitalizations of Texans have significantly increased. Specifically here in Nueces County, hospitalizations have increased exponentially just in the past 2 weeks. As of yesterday, across all Nueces County hospitals, there are 132 patients fighting the virus, with 34 currently in ICU. And as of Tuesday, the state of Texas has reported 10,086 active cases statewide. Last week, it was reported that Florida, Texas, and Missouri, which have lower vaccination rates, have accounted for 40% of all new cases nationwide. So your city and county are doing everything possible to make sure that you're informed and to have access to vaccinations. We know that unvaccinated people are at the greatest risk, and you can lessen your risk of contracting the virus by simply getting vaccinated. The City County Health District will hold a mass vaccination site next Friday, August the 6th, at the Old Memorial Hospital from 7:30 a.m. to 7:30 p.m. Registrations will be required as they were before, and that information can be found on the city website, or you can call 361-826-7200 and press option 2. The vaccines are widely available, and La Palmera Mall is also one of the easiest locations to get vaccinated. The clinic is in the old Charming Charlie location, and it's open 7 days a week during regular mall hours. And that would be from Monday through Saturday from 10 a.m. to 9 p.m. and Sundays from 11 a.m. to 6 p.m. for ages 12 years and up. So these vaccinations are free. We want to remind everyone of that. And that's brought to you by our City County Health District. We're also working as a community just to make sure that everyone knows not only the urgency to a great degree as of lately here, to get vaccinated, but we want to do everything that we can to make that convenient for you. And we're working on other measures and other ways that we can bring vaccinations more to you, if you will. But for now, we want as a team to let you know that we have a very strong message to you and to everyone to please get vaccinated. It's very simple. The other thing would be to remind those who have received their first dose and not received their second dose that it's not too late to receive your second dose. You have to wait up to 6 weeks after that first dose, but you can get the second dose at any time afterwards. And that's extremely important because we understand that they're very busy. It's very easy to forget or to not make the time, but it's not too late. And that's the main thing we also want to tell those who have gotten their first dose. So with that, we'll go ahead and translate in Spanish, and then we will welcome our County Judge, Barbara Canales.
Debido al aumento de casos por COVID en nuestra área, decidimos llevar a cabo esta conferencia. La variante Delta continúa propagándose y las hospitalizaciones han aumentado. Aquí en el condado de Nueces, esas cifras han aumentado rápidamente en las últimas 2 semanas. Tan solo ayer, 132 personas se reportan en el hospital, 34 en la unidad de cuidados intensivos. Son 10,086 los casos activos en todo el estado de Texas desde el día martes. Los estados de Florida, Texas y Missouri son los estados con el menor número de personas vacunadas. Nosotros aquí hemos hecho lo posible por facilitar esa vacuna a nuestros residentes. El próximo viernes 6 de agosto se van a llevar a cabo una mega clínica de vacunación en el antiguo Hospital Memorial de 7:30 de la mañana a 7:30 de la noche. Para registrarse se le pide llamar al 826-7200. Asimismo, se va a llevar a cabo la prueba de detección del COVID en la clínica ubicada en el Centro Comercial La Palmera los días martes y los jueves. Las vacunas son gratuitas para todas las personas mayores de 12 años y las pruebas realizadas por el Distrito de Salud también son gratuitas.
have our County Judge, Barbara Canales.
Thank you so much. Good afternoon. Barbara Canales, Nueces County Judge. Well, today, legislators had a call with the Texas Department of State Health and Human Services, and the main commissioner is Dr. John Hellerstadt. The purpose of the call was to discuss COVID-19. Our State Senator Juan Chuy Hinojosa passed on to me this afternoon Dr. Hellerstadt's message, and it is my desire to make certain that all of you hear this loud and clear. We are, again, at a critical point. We are seeing a surge of COVID cases and hospitalizations across the nation, and Texas is no exception. This Delta variant, you're going to hear more from Health Director, but I want you to know that Dr. Hellerstadt told us that it is more transmissible, it is more deadly, and individuals with underlying vulnerabilities are at a higher risk of severe infection and death. 95 to 99% of those currently hospitalized are unvaccinated. Please let me say that again. 95 to 99% of those hospitalized in our county are unvaccinated. We cannot eliminate this terrible and deadly disease without more individuals in our state getting the vaccine, and of course, our county needs to play a large role. If you have not gotten the vaccine, I'm going to urge that you get one as soon as possible. The vaccine not only protects you, it protects our businesses, it protects our children, it protects our workforce, our loved ones in nursing homes, our grandparents, our parents. The caregivers for the homebound are protected in this way. When you get the vaccine, it protects jobs. It protects our economy. It protects the 9,000 healthcare workers that are represented by the HCA, Driscoll, and Christi system alone, not to mention the other thousands and thousands of associated healthcare workers in our community. The bottom line, when you get the vaccine, you protect our healthcare system, our hospitals. The bottom line is that you protect all of us. You can help put COVID behind us. We have the vaccination clinics that the mayor just expounded upon. And here's something new. We can help you arrange transportation. I just got off the phone with the RTA, and if you call the RTA, they will arrange transportation for free for you to get to La Palmera Mall or to get to that great Friday clinic coming up on August the 6th. If you're homebound and you miss those early opportunities to get vaccinated, we can still help you. Even if you're in the rural communities, even if you're in the colonias, even if it's very remote, we will come to you. We're going to be standing up our county call center. As you know, the city also has a great website where you can access a call center as well. The bottom line is we're going to make sure between the city of Corpus Christi, the county of Nueces, and all the small cities in between, that if our residents need help finding a clinic for vaccinations or getting to that vaccination clinic or having that vaccine brought to them, we're here to answer your call. We're going to support an expansion of our city-county public health departments in its entirety, their entire outreach efforts. You're going to get our undivided attention over the next few weeks. Annette Rodriguez, shortly, our public health director, will elaborate on all these locations and times and plans. The county is going to focus, particularly in the crossroads and the rural communities, on setting up monoclonal antibody clinics. Do you remember that the monoclonal antibodies are those laboratory-made proteins that mimic the immune system's ability to fight off any harmful pathogen, but particularly like viruses like the SARS-CoV-2, which is our COVID-19. That's the coronavirus. Now, for those that are infected, particularly those whose immune systems are compromised or unresponsive, this particular antibody therapy is incredibly effective. In fact, we like to say it's a game changer. It's a true breakthrough. And even though we're already doing it here at the Dr. Hector P. Garcia Wellness Center, we want to make certain, as we see these statistics rise, more cases, means more people will be receiving those mild to moderate symptoms. And we can make certain with this monoclonal antibody therapy that we can help those folks. We still have an active COVID clinic, and we'll provide to you, the media, the number again, but always refer back to the city's website or the county's website for all the great information. But the COVID clinic is a free clinic, free all the way. Free labs, free x-rays, free diagnosis, free wellness opportunities if you have COVID or you had COVID. Look, I'm so grateful that we have these treatments, and I'm so proud that Nueces County and the city of Corpus Christi are the leaders bringing these opportunities to all of us. But there is no doubt that things have changed, and we made a promise at this podium that when we see data change, we're going to let you know. Are we setting off the alarm bells? What we are telling you is there is a drastic change in the statistics in your county, and you can help us. Now, many of you are going to be wondering about yesterday's announcement from the CDC regarding masks. What does that mean here to Nueces County? We've been fielding these questions all day. As you know, the revised guidance to recommend that even the vaccinated wear masks indoors in areas of high transmission, you should know that Nueces County is an area of high transmission. At least 2/3 of the entire country is an area of high transmission. So we're not unique, but unfortunately, we're in the wrong group. Now, in Nueces County, we're operating under the GA, Governor Abbott's order from March 2nd, 2021. Now, this order rescinded the statewide mask mandate, okay? So there is no mandate that's going to be pervasive in Nueces County. Why? Because there's a statewide mandate against such a thing. It also is the very order that removed the capacity limits for places like bars and restaurants. In that order, individuals were strongly encouraged, and we also mimic the governor's order in this. We strongly encourage here at Nueces County to wear face coverings over your nose and mouth, particularly if it is not feasible to maintain the social distancing from another person. And of course, if you're unvaccinated or in congregate settings. So masks have always been advised, always been encouraged as a preventative measure. They've not been mandated. And again, we're going to mimic our governor. We want to highly encourage those that are vulnerable, that are compromised, that are in congregate settings, and particularly the unvaccinated. That's where you really need to encourage this mask mandate. The governor's order recognizes the mitigation strategies, like requiring masks, have proven that they can slow the spread of the virus, and we believe that. In this order, county judges were given the authority to impose mask requirements and set capacity limits under certain conditions only. The key factor here is what's called the COVID hospitalization rate. And I'm going to direct your attention to the screen here shortly. What is the COVID hospitalization rate? It is the number of COVID patients in the hospital divided by the available capacity across what's called the trauma service area. And by the way, you'll hear this referred over and over as TSAU. U is our region, all right? And if it's 15% for 7 days consecutive, the county judge has the authority to issue any mask mandate or impose any capacity restrictions. Now, let's take a look at some history here. Without getting too far away from the mic, take a look at inception, where we were yet last year versus where we are now. You can see that awful spike last July, and then another spike and surge right about the time that we were seeing the vaccines come online. And then look how fantastic we did. You know what this is called? Success. We were doing great. And now look at this trend as it dips completely back up. What does this red line mean? That red line is the line, it's called the point of no return. We do not want to be at that red line again, because that red line means that your hospitals are highly compromised. They're not able to staff up correctly. We will lose the ability perhaps, or at least be at risk for elective surgeries again. We cannot go back here. That is why we're at this podium today. Now you say, well, that doesn't look so bad, Barbara. Let's take a look at the next slide. Our hospitalization rate has just about doubled in 1 month. We went from being about 3 to 4%. Now we're almost at 8. If this trend continues, by the end of the month, we'll meet that horrible red line. And that is why it's so critical that everybody hear this news. The trend does not look good. And I'm very glad, as I said, that we have all these tools at our disposal. But I would rather drive this hospitalization rate down by doing what we know absolutely works. Get vaccinated. Do it tomorrow. Do it today. You still have a few hours before it closes at La Palmera Mall. It's your greatest defense against getting COVID. And for those of you who do, it greatly reduces the severity and duration of the illness. I am not here to tell you that breakthroughs do not occur. I am here to remind you that 99% of the folks across this country are unvaccinated that are hospitalized. And in our community, it's about 95 to 99%. Practice the social distancing. Give yourself a little more room. As much as I love hugging and doing all those amazing things, let's go back to fist bumping until I can bring you a better slide. We can do it. Those last 3, the W's that we've been talking about, the wearing the mask, watching the distance, and washing your hands, look, we did that all last year, and that was all about that defense. And then in January, we literally were able to go on offense because we got a vaccine, and we thought our prayers had been answered. We fought back, guys, and we made so much progress, and those slides prove it. But viruses mutate, and this new variant is easier to transmit and cause more severe illness. And it's as if the virus is fighting us back. And we know that today's virus vaccines worked against this crazy mutation that is known as the Delta variant. You remember when people waited overnight in their cars, slept at the fairgrounds to get vaccinated? You remember how limited we were way back in January and how we had all those mass vaccination clinics? Well, today it's so much better and easier. We've got so many vaccines in stock. We're ready for you. I don't want to see us go back to those frantic days of January and February. I would give anything for people to see that we have that same sense of urgency today. And I know that the CEOs of the hospitals that have joined us here today wish that as well. Now, there's many of you that are on the fence, that you just need more information. Maybe you don't like needles. Maybe you're scared of them. Maybe you're scared of some of the information that you've heard. I understand. And we want to get you the right information. We don't want to push you into doing anything you don't want to do. We don't want to force you. We want to share with you the truth. Because the truth is that without the vaccine, you're in danger of getting this Delta variant virus. And I want you to look at what this Delta is doing to our country. I want you to look at what it's doing to this county and our hospitalizations and to the families that are affected. It's striking the unvaccinated. It's making them sick, and it's killing them. If we could only get back to that sense of urgency. Last year, it was all about one thing, praying for that vaccine. But now, we get to fight back. Please get vaccinated. Make it a priority. Talk to your family members that are not vaccinated. Make that a priority. It is truly the best thing you can do for yourself, for our businesses, for our jobs, for our healthcare system, and for this community. We've come so far. I used to tell my kids, keep your eye on the prize. What is our prize? Our life. Our life. Getting back to normal. I went to the University of Texas, and we have a tradition, and I know I got a lot of Aggie friends, probably even in this room. But at the University of Texas, one side of the stadium gets up and yells, Texas, and the other side of the stadium yells, fight, and it's deafening. And it gives you goosebumps. I want to tell you, all of you listening here today, nueces, fight. Fight back. Fight this virus. Get vaccinated. Please help us save lives today. We're here to help you. My phone number is 888-0444. I can be reached at barbara.canales@nuecesco.com. Call us. If you need help, if you're on the fence, if you just need someone to go with you, I'll go with you. We'll get RTA to get you a ride. We'll come to your home. We're in crisis again. Let's get out of it by fighting back. Thank you.
El día de hoy, legisladores estuvieron en comunicación con el comisionado de salud John Hellerstedt para discutir el COVID. Y el mensaje es claro, nos encontramos en un punto crítico. Hemos visto un aumento en las hospitalizaciones en toda la nación, sin excepción. La variante Delta se transmite más fácilmente, causa más muertes y de las personas que están en el hospital, del 95 al 99% no están vacunados. Si aún no se ha vacunado, es momento de hacerlo por todos nosotros. Le ofrecemos todas las facilidades para obtener la vacuna, especialmente para quienes no cuentan con transportación. También estamos apoyando las clínicas de prueba monoclonales para ayudar a combatir el virus en las personas infectadas. Esta terapia ha ayudado a recuperarse a muchas personas infectadas. En cuanto a la recomendación de los Centros de Control de Enfermedades, el uso del cubrebocas, ahora se recomienda que las personas vacunadas y se encuentren en áreas con alto número de casos utilicen el cubrebocas. Aquí en el condado de Nueces seguimos las directrices por parte del gobernador. El uso de cubrebocas, aunque no es obligatorio, sí es recomendable. De acuerdo a la orden del gobernador, los jueces tienen la autoridad de imponer los requerimientos del uso de cubrebocas bajo ciertas circunstancias, y esas circunstancias es el número de personas hospitalizadas. Le pedimos use el cubrebocas, vacúnese lo más pronto posible y continúe practicando el distanciamiento social. También lave sus manos seguido. Ahora contamos con un sinnúmero de clínicas de vacunación, por lo que le pedimos que lo haga por su familia y por su comunidad. Si usted necesita más información por parte de la oficina de la juez del condado de Nueces, puede llamar al 888-0444.
Thank you. Annette Rodriguez, Health Director. So I'm going to turn to some of the statistics here locally since we haven't seen those in a while. So here's our first slide here, and I think as the judge showed as well, you see the winter peak in January where we had 5,565 COVID cases. And then you see we were doing really well and those numbers were coming way down in June. Everybody was starting to enjoy themselves, and then July is starting to see that uptick again that we've been talking about with 2,256 cases in the month's not over. So we've seen over 100% increase in 1 month. I'm going to open up on the next slide these last 2 months, June and July. So if you look at for June, and June comes all the way to, you see that it's about 200 cases every week in June. But then what happens right after the 4th of July, and that week is also 199, 200 cases for that week. But right after the 4th of July, the following week, we have 100% increase. So we go from 200 cases to over 400 cases. And the following week, we double again. We go from 400 cases to over 800 cases. And then this week isn't over yet. That's only depicting 4 days of the week. And so we know that it's going to exceed more than likely last week's number of 815. And right now we're at 773 COVID cases with 3 days still to finish out the week. Next slide. The other real important increase that we're seeing and are concerned with are the hospitalizations. And so we started out, again, we started out low. What I tell everybody is that our baseline for the 3 healthcare systems was around 25, let's just say on average. Between the 3 healthcare systems, there was about 25 COVID cases every day that still, we're still seeing hospitalizations, but 25 was like, we can work with this is doable, we can get these numbers down, we just need to keep working at it. But what happened, we saw that jump back in the middle of July or the beginning of July, around July 8th, we saw a jump over 30. So 30 hospitalizations, so we're like, okay, what's going on there? And the next day we saw it jump to 42 and then to 44, and then we saw it jump to the 50s, to the 60s very quickly, to the 70s, to the 80s, over 120 on July 26th. And then today we were at 132 hospitalizations, 34 of these individuals in the ICU struggling again with COVID-19. And what we now believe that the majority of these cases are due to the Delta variant. Over 50% of the cases identified are Delta or even higher at this point, because Delta variant is very efficient at what it does. It's very good at jumping from host to host, from person to person, infecting people. And then if you look at the orange bar right there where we were, back for a second, the orange bar, on July the 19th, that's where we exceeded the 20 people in the ICU per day between the 3 hospitals. So, and if you look at today's ICU patients, we have 34 between the 3 hospitals. Again, those numbers going up and going in the wrong direction. So everybody probably has heard that last Friday on the 22nd, we identified our first Delta variant here in Nueces County, but we knew prior to getting that official document, we knew that Delta was already here in Nueces County. And again, that was because you start seeing those cases increase so rapidly that you know that you have a more efficient variant. So we're confident that there are more Delta cases in Nueces County. The confirmation also limits us because when people come in to get tested, they get tested, and so when we tell them they're positive, we tell them they're positive for COVID-19. We don't tell them they're positive for COVID-19 and they have Delta. Delta is an entirely different test to genosequence, and it takes time, sometimes as little as 2 weeks, sometimes up to 6 weeks. So it just depends, and as more tests get sent off for sequencing, the time frame is going to get longer. So we are talking with the Department of State Health Services currently about possibly genosequencing in-house. We all know that the health department has a laboratory response network. We don't currently have equipment or trained personnel for genosequencing, but the state is wanting us to consider that. So we are in conversations with them at this time because we understand how important that is. Next slide. Finally, I'm going to talk a little bit about the vaccine breakthrough cases. A lot of questions still are being asked of us, of all these people that you've vaccinated, and we've vaccinated well over, 250,000 people in Nueces County, how many people are getting sick, So what we've seen is 217 cases that are vaccine breakthrough cases. Disregard the numbers for the vaccine status. Those were not updated because these breakthrough cases are occurring very quickly. So last Tuesday when we ran the numbers, there was 166 breakthrough cases in 1 week. It's 217. The week before that, it was 145 breakthrough cases. So from 145 to 166 to 217 people with vaccine breakthrough, which means they had their 2 vaccines or they had their 1 vaccine of J&J, and then 2 weeks after that, they got COVID-19. And that's what a breakthrough case is. So people ask, if I'm fully vaccinated, can I still get COVID-19? And the answer is yes. But we do believe that the individuals that get COVID-19 have usually more mild to moderate symptoms. So that is a good news item. One of the concerning parts, and the reason why you see the recent change with the CDC guidelines, is that these individuals that are vaccine breakthrough, we do something that's called a CT. It basically checks for viral load. And what we're finding is that even though they've been fully vaccinated, their viral load is still as high as if it were an unvaccinated individual. And they can actually transmit this Delta variant to other people just as efficiently as a non-vaccinated person. So we have seen here in Nueces County 25 people hospitalized, and we have also had 4 deaths from vaccine breakthrough cases. Again, the majority of people vaccinated were Moderna, because that's the most vaccine that we use mostly here in Nueces County, and then Pfizer, and then J&J, and then one unknown case. And so finally, what are these new guidelines? So CDC's new guidelines, they put these out yesterday, and they basically are for K through 12, for school-age children, and the recommendations that all people, students, teachers, and administrators should wear masks when they return to school this fall. You know that we have some schools that are year-round that have already started, and so we've already had conversations with them, and they seem like they're all on board to go ahead and protect everybody, especially for those children 11 years and younger that cannot get vaccinated. So we want to make sure to protect them. Everybody 2 years and older, whether you're a student or an administrator or a teacher, should be wearing a mask when you're in school this fall. Again, this is just to protect everybody from the new Delta variant. In addition to that, CDC also recommends that all people should wear masks in any public indoor setting, regardless of their vaccination status. And I think that's where a lot of people are like, what? I thought we could take off our mask. That was at the time, but the new science has shown that, again, that you can pick up this Delta variant and that you can transmit this Delta variant to other people. So again, in an effort to protect our community, because there are people that, you know, they spend 2 or 3 nights trying to get vaccinated early on. I think all of you remember that they were camping out at the Richard Borcher Fairground. They were doing everything in their power to protect themselves. And so people that are not vaccinated, you know, to still be able to get them sick is very unfair. So we really need to work together as a community to keep everybody as safe as possible. So fully vaccinated people should put their mask on indoors where substantial or high coronavirus transmission levels exist, and that is here currently in Nueces County. The health district is also planning the mass vaccination clinic. It's important enough for us to make it very convenient. You can come through as the drive-through through Memorial. You just drive through, register before you come out there, 7:30 in the morning to 7:30 p.m. There's no excuses. If you've been waiting to get vaccinated, you didn't want to get out of your car, you didn't want to walk, just come through our drive-through. We'll vaccinate you there, very quick and easy, 15-minute wait, and then you're on your way. We will plan additional clinics as we continue to see the demand. And finally, these are some of the resources for the community. The main ones are the COVID clinic. I think we talked about this in depth for, for many, many months about the COVID community clinic. That phone number is 361-826-8019, and you can schedule an appointment 8 to 5. The only difference between that clinic and the other two is that you have to be COVID positive and having issues to go to the first clinic. The other two, the Coastal Bend Wellness Foundation, as well as ourselves, the health district, we offer free COVID swabbing. So if you're not feeling well, you think you might have COVID-19, you're worried about having the Delta variant, you can call either 361-356-9572 to schedule an appointment with Coastal Bend Wellness, or you can call us at the health district at 826-1339, and we'll schedule your appointment. So remember, wear your mask in any public indoor setting, whether vaccinated or unvaccinated. Do your part to protect our children that are currently unprotected and vulnerable. Follow the public health strategies and get fully vaccinated as soon as possible. Thank you. I'll be available at the end for questions. I'm now going to turn it over to Dr. Mary Dell Peterson, Driscoll Children's Hospital. Thank you.
Los casos activos en el mes de septiembre del 2020 eran de 1,655. El mes con mayor número de casos fue en enero con 5,565. En junio del mes pasado fueron 987. Tan solo en lo que va de este mes son 2,256 los casos. El aumento es significativo. La tercera semana de julio se reportaron 815 casos. Esta semana van 773 casos y solo van 4 días. Las hospitalizaciones también van en aumento. A la fecha hay solo un caso de la variante Delta registrado en el condado de Nueces, pero sabemos que hay más casos y pronto se van a reportar casos adicionales. La confirmación es limitada ya que toma de 2 semanas a 1 mes en recibir esa confirmación. Los casos de personas que han enfermado a pesar de contar con la vacuna han sido 217. 25 han sido hospitalizados y se han reportado 4 muertes. De todos los casos, las vacunas utilizadas fueron Moderna 78, Pfizer 57, Janssen 30 y uno de origen desconocido. Los Centros de Control de Enfermedades recomiendan la utilización del cubrebocas ahora que los niños regresan a clases, no importa el estatus de su vacunación. La vacunación es actualmente la mejor manera de prevención del COVID. Estudiantes, maestros y personal docente se les sugiere utilizar el cubrebocas cuando regresan a clases. Las personas vacunadas deben utilizar un cubrebocas cuando estén en áreas cerradas en donde los niveles de casos por COVID sean altos. Esto incluye el condado de Nueces. Entre los recursos locales se encuentra la clínica comunitaria, el número es 826-8019, la Fundación para el Bienestar del Área de la Costa, el número es 356-9572 y el Distrito de Salud Pública, el número es 826-1339. Estos dos últimos ofrecen la prueba de detección del COVID de manera gratuita.
Thank you. My name is Dr. Mary Del Peterson, and I'm the Chief Operating Officer and Executive Vice President for the Driscoll Health System. And I want to reiterate what our city and county leaders have said before, that we are in a very critical time. We are seeing exponential growth of the COVID virus, most likely due to the Delta variant. We know it's about 2.5 times more transmissible than the prior variants that we have had in our community. And I want to talk a minute about what herd immunity is. No vaccine is 100% effective. That's why we ask pregnant women in the 3rd trimester to get a flu shot and a pertussis or whooping cough booster shot. That's because their baby cannot be fully vaccinated until he or she is 6 months old. We also ask for grandparents and fathers and others around that infant to also get vaccinated for whooping cough. That creates a cocoon around that baby to prevent that baby from getting an infection. That is what leads to herd immunity. When we get enough people that are vaccinated, we create these cocoons of protection, because not all people can be vaccinated at this point. Children under 12 cannot be vaccinated yet, as well as those of us who are older may not have as good an immune response. And there are some people that medically cannot receive the vaccine. Fortunately, few, but there are some. And so it really takes a village to provide this herd immunity and protect our more vulnerable populations. We are so fortunate that the vaccines we have are incredibly safe and effective. You know, our physicians were first in line to get it. We are doing a study at Driscoll looking at children under age 12 for Pfizer vaccine, going all the way down to 6 months. We had no trouble recruiting for infants and children with families wanting their children to get those vaccines. And a lot of those were physicians' kids because they know how protective and effective it is and how safe. And so I urge you, everybody, age 12 and older, please get your vaccine. Don't be like the person on the Facebook post where they were actually dying in the process of getting on a ventilator and asking to be ventilated, asking to get vaccinated. It's too late at that point. You need time to build up your immunity. So please take advantage of the city, county, health department offerings and get vaccinated. The other quick point I'd like to make, I would like to ask the community, if you have children that are not that ill but you need to get them tested for COVID, please call your doctor and get an order, and we'll have drive-through testing at Driscoll for those kids. But please, we're seeing a surge in our ERs just for testing, and we really need to reserve those slots for patients that are significantly ill. So please take advantage of calling your primary care doctor, and we will offer drive-through testing for children. But that's a more appropriate use of our ER resources, as we're also seeing a resurgence of respiratory syncytial virus as well. You know, we can do this. We can raise our vaccine rates. We're only at 46%. Our neighbors to the south and west of us are closer to 80%. We can get this done so that we can protect ourselves, our families, and our businesses. Thank you. Oh, I'd like to introduce Dr. Osbert below. I think he's next on the list.
Quiero reiterar lo que han mencionado. Hemos visto un aumento importante debido a esta variante. En cuanto a la inmunidad comunal, esa inmunidad ayuda a que otras personas, quienes no, por algún problema médico no pueden vacunarse, así podrán estar protegidas para quienes son los más vulnerables. Estamos confiables de que las vacunas son seguras y le protegerán contra el virus. Le pido que se vacune y evite más muertes. Toma tiempo lograr una inmunidad. Si usted cuenta con menores de edad quienes deben de tomar la prueba del COVID, llame a su doctor y nosotros le ofreceremos la prueba móvil. Hasta el momento creemos que el 46% de todos los residentes han recibido su vacuna.
Oh, good afternoon. I'm Osbert Blow. I'm the President and Chief Medical Officer for the Christi Health System. I thought about talking to you from that capacity, but I'd really like to talk to you more as a father, husband, and fellow citizen, a neighbor in this Nueces County. We are all here looking at data, seeing what is ahead of us. We know what's ahead of us. We've been there. We have survived it. And as one of the people who was one of the first to get the vaccine, and I was proud to do so, and I was terrified to do so, but weighing the risk and benefits, I'm so glad that I did. As the leader of one of the healthcare systems that facilitated over 125,000 vaccinations in the Coastal Bend area, I stand here before you very proud, having done that. I also stand here very sad to have to tell you that my colleagues, and by that what I mean by colleagues, I mean all of the frontline workers. I'm a trauma surgeon by training, so the ED is not unfamiliar to me. When I walk through the hospital now in my current capacity and I see my fellow colleagues, nurses, CNAs, environmental care providers, everyone, doctors, you name it, everyone is essential in a healthcare system. Everyone is essential in a community. And you look at them, they are exhausted. They are exhausted and they are scared because they know that we're going to go through this again. And what makes it even that much more tragic is that we don't have to go through this again. You've heard from all of our city and county leaders, from my colleagues in healthcare administration, one who will follow me. But what I message to you is really, I implore you, if you are eligible to get the vaccine, you're not doing it for yourself, do it for our community. That is truly the only way we will survive this. The numbers are showing that. In our hospital system, 85 to 99% on any given day are non-vaccinated hospital admissions who have COVID-19. Those who are vaccinated, some of them had incomplete vaccination protocols, but when they do, they're coming in, and yes, as Annette said, the good news is they are having milder disease and they are leaving. That is totally a different picture from what we went through last summer. So again, less so for me as a president and chief medical officer, but more so for me and my family, my 7-year-old daughter. If she could get the vaccine, I would have her go right now. So if you're 12 and over, please get that vaccine and do it so that we can all survive this summer and look forward to a lifetime together. Thank you. And I'd like to introduce Mr. Eric Evans, who's the CEO of CCMC.
Te quiero hablar como padre, esposo y residente. Nosotros hemos visto los datos, las tendencias y sabemos que es lo siguiente. Muchos de mis colegas médicos, enfermeros, todos son esenciales en la comunidad y si los viera están exhaustos y temen que volvamos a pasar por lo mismo. Usted ya lo escuchó por parte de los líderes de nuestra ciudad. Le imploro que se vacune. Hágalo por su comunidad. Mientras las cifras continúan aumentando, mucho más del 80% de las personas hospitalizadas no están vacunadas y quienes enferman, los síntomas de quienes están vacunados son mucho más leves. Si cuenta con 12 años o más, le pedimos que se vacune, hágalo por su comunidad.
Good afternoon, everyone. I'm Eric Evans. I'm the CEO of Corpus Christi Medical Center. And I feel like in the immortal worlds of Yogi Berra, it's deja vu all over again. So here we are. I joined this community last June, and we saw a huge spike and increase. And as everybody has said, and Dr. Blow, that was very difficult. And so we're here as a community, we're here as hospitals to take care of each and every one of you. But we are your friends, we are your neighbors, and we want to get back to life as it was here just a couple months ago. We felt like we were getting out, and being able to get in the clear, and everybody was vaccinated. But we're dealing with a preventable crisis. We're dealing with a crisis that has to do with the unvaccinated. We are seeing the unvaccinated in our hospital. 97% are unvaccinated that have COVID. The mortality rate, 99% are unvaccinated, and they're much younger. We're seeing in the ICU 30-year-olds. That didn't happen last summer. We implore you, everybody, I echo what everybody has said, whether it's the mayor, the judge, all the healthcare leaders, please get a vaccine. It works, it's effective. I've taken it. There's not a plant of a chip in you. There's not anything that's going to create some type of tracking system. What it does is give you a fight. I like that, Texas fight, right? I like that, Judge. I'm a Longhorn. So I think, let's fight. I like that. An Oasis fight. That could be a rallying cry. Let's fight against this disease. When you're out in a crowd, if there's only 50% of the population that's been immunized and people aren't wearing masks, they're not immunized. So those who are vaccinated, please encourage your friends, your family. We don't want to see you in the hospital. We're here for you, but we don't really want to see you, our neighbors, our loved ones in our hospitals. So again, as everybody has said, please get the vaccine. If not, for you, for your community, and for your county. Thank you.
Aquí estamos otra vez, donde el mes pasado de junio la situación fue muy difícil. Estamos viendo lo mismo otra vez. Hace un par de meses ya todo parecía estar mejor. Estamos lidiando con algo que se puede evitar, pero las personas que están hospitalizadas no están vacunadas. Estamos viendo jóvenes en sus años 30 en el hospital. Esto no lo vimos el año pasado. Vamos a lidiar y vamos a tener que pelear en contra de este virus. Por favor, vacúnese. Si no lo hace por usted, hágalo por su comunidad.
That concludes our press conference today. We do have, everyone is still here available. If you have questions, we can open it up now for questions. Seeing none? Very good. Thank you for being, go ahead.
Are we going to have to see these become regular, these briefings again, like they were daily and weekly?
We are having conversations about reinstituting these briefings, but I don't have that information right now to give to you.
And lastly, it seems like there's a 54-day mark from getting your second shot before people are coming down with COVID-19. Are we seeing that magic number, or is that any truth to that?
The ones that we were most concerned with, that we wrote those numbers in for, was 24 to 54 days from being vaccinated with their second vaccine. And so the message really for me there is because of those 4 deaths. It's from those 4 deaths, that 24 to 54, is even though you're fully vaccinated at 2 weeks, there's nothing wrong with wearing your mask for 2 months. I know it sounds terrible, but 2 months, to not to have to die, I think it's worth it. So extending that a little bit, that mask wearing after you're fully vaccinated would help. You're welcome. No other questions? Thank you for being here today. We appreciate you all.